You are standing at the bathroom mirror this morning, and you turn your head just slightly, the way you do 100 times a day without thinking about it. And there it is again, that dark ring around the base of your neck. You have scrubbed it before. You have used a washcloth, then a scrub brush, then maybe even a little vinegar because someone told you that works, and it never comes off. Not because you are not scrubbing hard enough, because it was never dirt in the first place. Before I tell you what that dark patch actually is, I want to ask you for something small. If you are over 50 and you have ever noticed a darkened patch like this on your neck, your elbows, or your knuckles, hit subscribe right now, because what I am about to explain applies to more of you watching this than you probably realize, and I make videos like this every single week for exactly this community. It costs you nothing, and it means you will not miss the next one. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and for the last 15 years, I have worked almost exclusively with men and women over 50, the people who show up in my office thinking something small is nothing, when very often it is the first sentence of a much longer story. I have looked at that exact dark ring on more necks than I can count in my clinic on patients who came in for a totally unrelated reason, a knee, a cough, a follow-up on their blood pressure. And more often than they expect, that little patch of darker, thicker, slightly velvety skin turns out to be one of the earliest visible signs the body gives us that something deeper is already underway. Tell me something before we go further. Have you noticed a darker patch like this anywhere on your body? Not just your neck, maybe your armpits, your elbows, the back of your knuckles, or even the crease behind your knees. Type it in the comments right now because I read every single one, and it helps me understand exactly what to cover for this community next. Here is what almost nobody tells patients about this. That dark, slightly thickened, velvety patch has an actual medical name, acanthosis nigricans, and once you understand what causes it, you will never look at a dermatology chart the same way again. But before I get into the mechanism, I want you to understand something that took me years of practice to fully appreciate. Skin is not separate from the rest of the body. It is not just a covering. It is often the first place the body chooses to show you what is happening inside blood vessels you cannot see, inside cells you cannot feel, inside a hormone system that has been working overtime for years before a single lab result ever flags it. I will come back to exactly why the neck and the armpits and the knuckles specifically in a moment, because the location is not random. But first I want to walk you through what is actually happening at the cellular level when this patch forms, because once you see it, you will understand why so many doctors miss it, or dismiss it as nothing more than sun damage or aging skin. I want you to do something right now while you are watching this. Reach up gently with 2 fingers and touch the base of your neck, right where it meets your shoulders, or touch your elbow, or turn your hand over and look at your knuckles. Feel the texture. Is it smooth like the surrounding skin, or does it feel slightly raised, slightly thicker, almost like velvet or light sandpaper? Look closely at the color too. Is it evenly toned with the rest of your skin, or is there a distinct darker patch with a border you can actually trace with your finger? This takes 10 seconds, and what you find matters more than you think. Let me explain exactly what is happening in plain language, because once you understand the mechanism, this stops being scary and starts being useful. Insulin is the hormone your pancreas releases every time you eat, and its job is simple. It knocks on the door of your cells and tells them to open up and let sugar in from your bloodstream so it can be used for energy. In a body where insulin is working efficiently, a small amount does the job, the door opens, sugar goes in, blood sugar levels stay steady. But for a lot of people over 50, especially those carrying extra weight around the midsection, that door has become harder to open. The cells have grown resistant to insulin's knock, so the pancreas does the only thing it knows how to do. It produces more and more, trying to shout loud enough that the door finally responds. Here is the part almost nobody explains clearly. That flood of extra insulin does not just affect your blood sugar. Insulin, at high enough levels circulating in your bloodstream, also acts on the skin. It binds to receptors in skin cells and tells them to grow and multiply faster than they normally would. Think of it like a garden that gets watered by a hose left running all night instead of the usual gentle sprinkle. The soil does not just get a little more moisture, it gets waterlogged, overgrown, and the grass on top starts growing in thick, uneven clumps instead of the smooth, even lawn it used to be. That is essentially what is happening in the skin folds of your neck, your armpits, behind your knees, and across your knuckles. Excess insulin is telling those skin cells to overgrow, and the result is skin that looks darker, feels thicker, and takes on that velvety texture you may have felt a moment ago. The name for this is acanthosis nigricans, and I want to say that term one more time clearly. Acanthosis nigricans, because if you ever hear it from a dermatologist or read it on a chart, I want you to immediately connect it to what we are talking about right now, not to think of it as some obscure skin condition with no relevance to you. Now here is why the location matters so much. This pattern shows up almost exclusively in skin folds, the back and sides of the neck, the armpits, the groin, behind the knees, across the knuckles. That is not a coincidence. These are the warmest, most friction-prone areas of the body, and they are also the areas where insulin receptors in the skin are most concentrated. So when insulin levels rise chronically, these are the first places the body shows it. Long before a fasting blood sugar test or a hemoglobin A1C, which is a blood test that reflects your average blood sugar over roughly the last 3 months, ever flags a problem. This is where the myth I want to correct comes in. Most people over 50 who notice this patch assume one of two things. Either it is simply from scrubbing too hard and not rinsing properly, or it is a normal part of aging skin, like age spots or thinning skin texture. Neither of those is the reality. The reality is that this patch is very often one of the earliest visible signals of insulin resistance, appearing years, sometimes 5 to 10 years, before a formal diagnosis of prediabetes or type 2 diabetes ever shows up on a lab report. Your skin, in a very real sense, is trying to tell you something your blood work has not caught up to yet. I want to be precise here and not overstate this, because your trust matters more to me than a dramatic claim. Not everyone with acanthosis nigricans has diabetes, and not everyone with insulin resistance develops visible skin changes. But research consistently links this specific skin pattern to elevated insulin levels, and it is considered by endocrinologists, doctors who specialize in hormones and metabolism, to be one of the more reliable visible markers of insulin resistance that exists. Studies looking at populations with this skin finding show a meaningfully higher rate of impaired glucose tolerance and prediabetes compared to those without it, which is exactly why I take it seriously every time I see it in my own patients, even when they came in for something completely unrelated. There are a few other things that can make this pattern more likely to appear, and it is worth naming them honestly, rather than making this only about blood sugar. Carrying extra weight, particularly around the abdomen, is the single strongest driver, because fat tissue itself, especially visceral fat around the organs, actively worsens insulin resistance in a feedback loop. Family history plays a role too. Some people are simply more genetically prone to insulin resistance regardless of weight. Certain medications, including some used for hormone conditions or high-dose steroids, can contribute. And in women, conditions like polycystic ovary syndrome, often shortened to PCOS, are closely tied to this same insulin pattern, which is why some women notice this skin change even in their 30s and 40s. Long before we are usually talking about diabetes risk at all. Here is the mechanism I want you to really hold on to, because it explains why this matters for so much more than your skin. When insulin resistance develops, it rarely stays contained to one system. The same excess insulin circulating in your blood that is overstimulating your skin cells is also putting extra strain on your blood vessels, contributing to higher blood pressure, encouraging your liver to produce more harmful cholesterol particles, and slowly increasing your risk for heart disease, the leading cause of death in adults over 60. Think of insulin resistance less like a single broken switch and more like a slow leak in a foundation. It rarely announces itself with one obvious symptom. Instead, it quietly stresses several systems at once: the skin, the blood vessels, the liver, the pancreas, until eventually something more serious shows up: a heart attack, a stroke, a diabetes diagnosis that feels sudden but was actually years in the making. That is why I do not treat a dark neck patch as a cosmetic issue in my practice. I treat it as an invitation to look deeper, to check a fasting blood sugar, a hemoglobin A1C, sometimes a fasting insulin level specifically, because catching insulin resistance at this stage, when it is still reversible, is an entirely different conversation than catching it after a full diabetes diagnosis. The skin gave us a 5 to 10 year head start. The question is only whether we use it. I also want to address something practical, because a lot of patients ask me this exact question: why did my primary doctor never mention this patch during my last checkup? Often it is not because your doctor does not know about acanthosis nigricans. It is because a 15-minute appointment focused on your blood pressure medication refill or your knee pain simply does not leave room to examine the back of your neck or your knuckles closely, unless you specifically point it out. This is not a criticism of your doctor. It is simply the reality of how modern primary care visits are structured, and it is exactly why I am telling you to look for this yourself, at home, in your own mirror, rather than waiting for someone else to notice it first. If you do find this pattern on your body, the next step is straightforward and not something to panic over. Ask your doctor specifically to check a fasting blood sugar and a hemoglobin A1C at your next visit, and mention the skin finding by name so it gets connected to the right conversation instead of being treated as a separate, unrelated issue. In many cases, catching insulin resistance at this stage means the difference between reversing it completely through diet and activity changes and needing medication for the rest of your life to manage full-blown type 2 diabetes. That gap between reversible and permanent is often measured in just a few years, which is exactly why I wanted to make this video. There are a few other visible clues worth knowing, since we are already on the subject of what your body shows before a lab test catches up. Skin tags, those small, soft, flesh-colored growths that often appear on the neck or under the arms, tend to cluster in people with the same insulin resistance pattern for a very similar reason: the same excess insulin stimulating extra skin cell growth. A waist circumference over 40 inches in men or 35 inches in women is another strong predictor, not because of appearance, but because it reflects the visceral fat that drives this whole process. And unexplained fatigue after meals, especially a heavy, foggy tiredness 30 to 60 minutes after eating a carbohydrate-heavy meal, can reflect the same blood sugar swings underneath. None of these on their own confirm anything, but when 2 or 3 of them show up together, along with that dark, velvety patch, it becomes a pattern worth taking seriously rather than dismissing one symptom at a time. To give you a sense of scale, some clinical estimates suggest that as many as 1 in 3 adults in the United States over the age of 50 has some degree of insulin resistance, many without any formal diagnosis yet, which means this is not a rare finding I am describing. It is something a meaningful share of you watching this video may be walking around with right now without knowing it. I have seen this exact combination play out in my own practice more times than I can count, and one patient in particular has stayed with me because of how close she came to missing it entirely. I want to tell you about a patient of mine. I will call her Diane because that was close enough to her real name, and she gave me permission to share her story anonymously. Diane was 63, a retired elementary school teacher from a small town outside Columbus, Ohio, and she came into my office for what she thought was a routine follow-up on her blood pressure medication. She was not there about her skin at all. But as I was listening to her heart and lungs, I noticed a dark, slightly thickened patch on the back of her neck, right at the hairline, and I asked her about it. Diane laughed it off. She said she had noticed it for maybe 2 or 3 years and always assumed it was from wearing turtlenecks in the winter, some kind of friction mark that never quite faded. She had tried scrubbing it a few times, given up, and stopped thinking about it entirely. She had no idea it had a name, let alone that it might be connected to anything happening inside her body. I asked if I could run a fasting blood sugar and a hemoglobin A1C at her next visit, mostly out of caution, and when the results came back, her hemoglobin A1C was 6.1%. For context, a normal result is generally below 5.7%, and anything from 5.7 to 6.4% falls into the prediabetes range, meaning her blood sugar regulation had already been slipping for some time, quietly, with almost no symptoms she would have noticed on her own. What struck me most was not the number itself. It was how completely surprised Diane was. She exercised a few times a week. She was not what most people would picture as high risk, and she had never been told that a dark patch on the back of her neck was worth mentioning to a doctor. We started with dietary changes, mostly reducing refined carbohydrates and adding a short daily walk after her largest meal, and at her 6-month follow-up, her hemoglobin A1C had dropped to 5.6%, back into the normal range, and the patch on her neck had visibly lightened as well, not disappeared completely, but noticeably softer in color and texture. Her skin, in a way, confirmed what the lab numbers were already telling us. I want to be honest with you about something, because I think you deserve honesty more than reassurance that is not fully true. There is no billing code that pays a doctor to spend 5 extra minutes examining the back of your neck for a skin pattern that might predict diabetes 5 years early. The system we practice in is built to react once a diagnosis exists, not to reward the kind of quiet, preventive noticing that could have caught Diane's situation years earlier if anyone had simply asked the right question at the right visit. That is not a conspiracy. It is just how billing and time constraints have shaped modern medicine, and it is exactly why I believe so strongly in patients knowing what to look for themselves, instead of waiting for a system that was never built to catch this early. Here is what I want you to sit with for a moment. Your body has been trying to tell you something, quietly, patiently, for possibly years, in a place you look at every single day when you brush your teeth or get dressed. It was never asking for a scrub brush. It was asking for a blood test. And the good news, the real good news, is that insulin resistance caught at this stage, before it becomes full-blown diabetes, is often completely reversible through changes you have real control over, not permanent, not a life sentence, but a fixable problem if you catch it now instead of 5 years from now. If this explanation changed how you will look at your own neck tomorrow morning, do one thing for me. Share this video with someone in your life who mentioned a dark patch to you once and you brushed it off, or who you know has been dealing with borderline blood sugar numbers. It might be the single most useful thing you send them this month. And if you have not already, hit subscribe, because I am building this channel specifically for people over 50 who want to catch problems while they are still small enough to fix, not after they have already become a permanent diagnosis. Before we move into exactly what to do if you found this pattern on your own skin, tell me your age in the comments below. I ask this every single time, and I promise it is not just curiosity. It genuinely shapes what I recommend for you specifically, because the right approach for someone in their 50s still working full-time looks different than the right approach for someone in their 70s managing multiple health conditions. And it also shapes what topics I choose to cover next for this community. Let me ask you something that might catch you off guard. If I told you that the single number most predictive of your future heart attack risk was not your cholesterol, and it was not even your blood pressure, but the width of your waistline measured at your belly button, would you believe me? Most people do not, because we have been trained for decades to obsess over cholesterol numbers on a lab report while almost completely ignoring the tape measure. But waist circumference correlates more strongly with insulin resistance, and by extension with heart disease risk, than total cholesterol does in most large population studies. I bring this up now because it connects directly back to that patch on your neck. Both are windows into the exact same underlying process. Now, I promised I would come back to something, and this is the part that surprises almost every patient I explain it to. In the vast majority of cases, this dark neck patch is tied to insulin resistance, exactly like we have been discussing, and that is the explanation that applies to the overwhelming majority of you watching. But there is one specific pattern that is worth knowing about, precisely because it is so different from everything else I have described tonight. If this dark patch appears very suddenly, over just a few weeks rather than gradually over years, especially in someone without extra weight, without a family history of diabetes, and without any of the other risk factors we talked about, that fast, unexplained pattern occasionally points towards something else entirely, and in rare cases has been linked to an underlying condition that needs a different kind of workup. I want to be extremely clear, this is uncommon, and for the overwhelming majority of people, especially anyone who has noticed this patch developing slowly over a few years the way Diane did, insulin resistance remains by far the most likely explanation. But sudden, rapid onset is the one situation where I would tell you not to wait, and to see your doctor within days rather than at your next scheduled checkup. Before I give you the full action plan, I want to hear from you two things. First, has anything I have said tonight matched something you have noticed on your own body? Whether it is this exact patch or something else entirely, tell me your story in the comments. Because these stories are often what helps someone else watching finally take it seriously. And second, what should I cover next? I have a full list of topics for this community, but I want to build this channel around what actually matters to you, so tell me what is on your mind. I want to prepare you for something honestly, because I have watched this exact pattern play out with dozens of patients. If you start making the changes I am about to walk you through, cutting back on refined carbohydrates, adding movement after meals, there is a very real chance you will start feeling noticeably better within just 2 to 3 weeks. More energy, less of that heavy afternoon fog, maybe even a little weight coming off around your midsection. And here is the moment I want you to watch for, because it catches almost everyone off guard. That is exactly when most people quietly stop. Not because it stopped working, but because it started working well enough that the urgency faded. I want you to think of that early relief not as the finish line, but as the actual proof that the plan is working. And the real test is whether you keep going for the next 3 to 6 months, long enough for your hemoglobin A1C to actually reflect the change, not just how you feel day to day. So let me walk you through exactly what to do, starting today, if you found this pattern on your own skin, or even if you did not and simply want to lower your risk before anything shows up. The first step is simple. Book an appointment with your doctor within the next 2 to 4 weeks, not urgently, but soon, and specifically ask for a fasting blood sugar and a hemoglobin A1C. Mention the skin finding by name if you have it, acanthosis nigricans, so it gets connected to the right conversation from the very first sentence of that appointment. The second step involves your plate, starting with your very next meal. Reduce refined carbohydrates, things like white bread, sugary cereals, and pastries, and replace a portion of them with protein and fiber, things like eggs, beans, or vegetables. You do not need to eliminate carbohydrates completely. You simply need to stop flooding your bloodstream with the kind that spike insulin the fastest. The third step is a short walk, 10 to 15 minutes, after your largest meal of the day, ideally within 30 minutes of finishing eating. This single habit has been shown to meaningfully blunt the blood sugar spike that follows a meal, because your muscles pull sugar out of your bloodstream directly during activity, reducing the demand on insulin at exactly the moment it is working hardest. The fourth step is checking your waist circumference this week, measured at your belly button, not your narrowest point. If it is over 40 inches for men or 35 inches for women, that number alone is worth mentioning to your doctor alongside the blood sugar tests, because it reflects the visceral fat most closely tied to this entire process. The fifth step is sleep, and I do not say this casually. Getting under 6 hours of sleep consistently has been shown to worsen insulin resistance within as little as a single week, independent of diet. If your sleep has been poor, addressing that is not a minor lifestyle tweak, it is a direct lever on the exact hormone we have been discussing this entire video. The sixth step, and this one requires a conversation with your doctor first, is asking specifically whether a fasting insulin test, not just a blood sugar or hemoglobin A1C, makes sense for you. This test can sometimes catch insulin resistance even earlier than the standard tests, before blood sugar itself has started rising, though it is not always covered by insurance. So ask before assuming. The seventh step is simply watching your own skin over the next 2 to 3 months. Take a photo of the patch today, on your phone, dated, so you have an honest before picture. If you make the changes above consistently, many patients like Diane notice the patch itself beginning to lighten and soften within a few months, which becomes its own kind of visible progress report, separate from any lab number. And the eighth step, the one I probably care about most, is simply not dismissing this the way you might have a year ago. You now know what that patch means. You know it is not dirt, and it is not simply aging skin. Use that knowledge, starting with the appointment you book this week. None of these 8 steps require expensive supplements or drastic overhauls. They require consistency, and consistency is something entirely within your control, starting today. Before you go, I want to say thank you, genuinely, for spending this time with me today. Every single one of you watching, taking a few extra minutes to actually understand your own body a little better, is exactly the kind of thing that quietly adds years to a life. If this video helped you see something on your own neck, your own elbow, or your own knuckles differently, subscribe so you do not miss what I cover next. And so we can keep building this community of people who would rather catch a problem early than manage it for the rest of their lives. One last thing, and I say this every time because it matters every time. I am a physician, but I am not your physician, and nothing in this video replaces an actual examination and conversation with your own doctor, who knows your full history in a way I never could through a screen. If you found a dark patch on your skin, or if anything I described tonight sounded familiar, please bring it to your doctor directly rather than making changes based on this video alone. Take care of yourselves, and I will see you in the next one.